Welcome, Dr. Klein, to the Rob Newton Resource Hour. And, of course, these segments are used for other things at your company, as well as some of my other broadcast ventures. But today we're going to talk about something that everybody who listens to the radio, everybody on this planet suffers from time to time, and that is pain.
Okay, so you're hurt. Okay, what is pain? What isn't pain? What's it telling you? What is it not telling you? And what do we do about it? Pain is a little bit like the idiot light on your car. It turns on, it goes, pain. It doesn't tell you where it's coming from. It says check engine. Okay, check engine light. You got to take it in to have it looked at. Why? Because it takes a genius to be able to plug it into a machine and have it read out a code. Well, on you, it's a little bit more difficult. So your shoulder hurts. Does that mean your problem is occurring in the shoulder? Maybe yes, maybe no. Part of the challenge with this is getting a medical history so you can figure it out. But what else can cause shoulder pain? How about hepatitis? How about pancreatitis? How about diaphragmatic hernia? How about subphrenic abscess? How about a perforated gastric ulcer? How about a lot of different things can cause shoulder pain in addition to the muscle aching, the herniated disc, and or the rotator cuff that you might or might not have? Well, the fact of the matter is, okay, that the pain is the same. You can have numbness and pain down your left arm. Okay, and it might be coming from your elbow, it might be coming from your wrist, or it might be coming from your heart.
Ouch.
How do you tell the difference? Okay, well, it works something like this. Pain doesn't tell you where it's coming from. It just simply is what it is. Your body aches, your body hurts, your body burns. Could it be shooting? Could it be stabbing? Could it be throbbing? Could it be aching? Each one of these descriptors means something different to an intelligent physician. Okay, they do tell you whether it's muscular, whether it's nerve, whether it's tendon, whether it's viscera, or whether it's parasitic, for God's sake. You can have shoulder pain from eating undercooked pork. Okay, trichinosis will do this, so you can end up with lots of different causes for this, and people enjoy watching TV shows that are medical mysteries to realize that, gee, maybe the docs don't always have a handle on it the first time out of the chute. So what do? You got backache. Okay, so what's causing the backache? Well, my chiropractor told me I had a herniated disc. Oh, okay, well, let's figure this one out. Okay, 1/3 of all adults have herniated discs in the lower back, but may not have any pain at all. God help them if they pull a muscle, then get the MRI, you see the herniated disc, but guess what? The herniated disc did not cause the muscle pull. It did not cause the bursitis. It didn't cause the facet joint jam. It didn't cause anything. Okay, because an X-ray, an MRI, a lab study does not give you causality. It just simply tells you that it's there. It's a piece of data. It can be right, it can be wrong. It can indicate or it can be a red herring. We all remember what a red herring is. In this case, in pain work, it's more common than you'd believe. Individuals come in. They'll come in with hip pain, and they're told it's sciatica. Okay, well, where I come from, sciatica doesn't cause hip pain. Sciatica causes foot pain. The nerve goes from the lower back all the way to the toes. It doesn't stop only at your rear end. Okay, it's like a string of Christmas lights. When you damage that string, all the lights will flicker, not just one or two. So misdiagnosis of pain is extraordinarily common. And more than likely, you're going to be suffering this. You're going to be experiencing this. The pain that you're having in your hand, could it be carpal tunnel syndrome? All right, well, maybe it will, maybe it won't. But could it also be cubital tunnel syndrome? Causes the same symptoms. Could it be circumflex humeral entrapment at the shoulder, causing the same symptoms? What about golfer's elbow, for God's sake? That'll nail the ulnar nerve, but it'll look for all intents and purposes for being an entrapment someplace else. So you have to look at these things and step back and understand that the first piece of advice that you get, and more than likely the second and third, are going to be wrong. So what you need to do is understand viscerally, if you pardon the metaphor, you need to understand in your gut that you need to have more than one opinion, more than one person to look at this. They will disagree because that's what you're going to get. Everybody has an opinion, no guarantee that they will agree. And what you're not looking for is best 2 out of 3 or best 3 out of 5. This is not soccer here. It doesn't work that way. So what is pain? Pain is a cry. Pain is a scream. Pain is an indicator that something's not right. Okay, you can have bowel distension from gas. It can double you over with pain. But guess what? When the issue resolves one way or the other, the pain goes away. You can have a silent heart attack. That's probably the worst pain you can have, is the one without pain. You can have one of the most miserable issues of all, which is shingles. Causes terrible pain, sometimes long after the shingles goes away, called post-herpetic neuralgia. And then my single most favorite pain of all is called headache. Why? Because it's so difficult for most people to figure it out. And I like a challenge personally. Okay, headache, facial pain, marvelous. Lots and lots of fun, but it is what it is.
We have had so many calls on one of the shows we do in Orlando, a 2-hour show every Sunday on News 96.5 from 3 until 5 on Sundays. We've had numerous calls over the years from people who say they've got terrible hip pain, and you will analyze it, and they will call back and say you were right. And it had nothing to do with the hip. It had something to do with their foot.
Oh, it's amazing how this thing works. Okay, so all you need to do to prove this correct is to stick a stone in your shoe under the heel is the best place to do it, and leave it there for a week. So stick it under your right heel.
Oh.
Okay, in a week you're going to have left hip pain. Okay, right heel, left hip pain. A week after that, maybe 2, you're going to have right shoulder pain. And a week or 2 after that, you're going to have left-sided neck pain with pain to the left eye. We just induced a migraine by putting a stone or a pebble or something similar, some innocuous little nothing, in your right heel. It will cause contralateral, that's pain on the opposite side, of headache. So when you're looking at folks with headache, why in the world would you necessarily want to look at the shoulder, hip, knee, ankle, and foot? Because that's the way things work. If you were going to build a house, where do you start? You start with a foundation. If the foundation isn't plumb, if the foundation isn't even, if it isn't flat, or if it's not draining the way it's supposed to drain in certain key areas, problems ensue. You can't make up for something that's 10 degrees out of kilter, okay, by putting shims in the brick. It doesn't work that way. You know, there are companies out there that'll jack your foundation up, but you don't start with a jacked up foundation, and that's what leads to many of these fibromuscular issues. So what is the most common of all pains? What is the one that brings patients to the office most frequently? Oddly enough, it's headache. Okay, not backache, but headache. So what are we looking at? Well, I've got these severe headaches. They're migraines. Okay, well, migraine doesn't imply severity. It implies the cause. It implies the chemical imbalance that leads to this, and it's inflammation around certain arteries, small arteries within the brain. Then what happens is the blood vessels go into spasm, then they expand, and you end up with a headache. So how do you treat a migraine? Well, you treat it by adjusting the caliber of the blood vessel and by dealing with the inflammation. So what? So they gave you the triptans, they gave you this, they gave you that, and the headache didn't go away. That should be a clue, a big clue that maybe you don't have migraine. What could it be? Trigeminal neuralgia is a good one. Where would that come from? From gritting your teeth? Maybe. Could be from the trauma to the side of your head. Could be that elbow that you took over your eye a few years back, or the broken nose. These are ways of nailing branches of this nerve, which will cause headache sometimes a year or 2 or more after the trauma. Tendinitis behind the neck. Tendinitis at the base of the skull will mimic migraine. This is one of my favorite ones. People come in with headache that may have been there for years and years and years and years, and they spent many tens of thousands of dollars on medications only to find out that all they needed for this thing was a transdermal anti-inflammatory, or perhaps, something a little bit stronger at the base of the skull, and away she goes. My first patient with this particular problem, which was a tendinitis of a muscle called the splenius capitis, was 80. 82, 83. She developed this when she was 10. She fell off a horse, struck her head, and had constant headache for over 70 years. So what I did, because I really didn't know too much about transdermals, I injected the area, the headache went away. So I asked her, I said, how does it feel? I need to get feedback on this. She goes, I don't know. And I'm being a wise ass, because I'm 26 years old after all. And I asked her, I said, well, what do you mean you don't know? I mean, either it hurts or it doesn't hurt. And her response has influenced me to this day, and this has been over 30 years. She said, I don't know what it's like not to hurt.
Oh, wow.
I don't know what this feels like. And after that, I realized something, And what I realized was that I really didn't know a damn thing. And I've realized that on a daily basis ever since. A bit of wisdom from this 80-some-odd-year-old lady. I did take care of her headache, but she had never experienced a day in 70 years where she hadn't been in pain. Not a moment.
We're going to call voluntary overtime here because I got to ask you about this. Oftentimes, when people claim it's a migraine, they say the light is too bright. What effect does light have on a headache?
Okay, what will happen is that a couple things. Okay, now if it is in fact migraine, it causes this photophobia. It's an activation of the nerves in the body. Little things will bother you. Noises will bother you. But sometimes there are cluster headaches that'll do this thing also, and the pupils will dilate and the light will hurt you. If you've ever gone into the optometrist, optician, or you go to the ophthalmologist, they will dilate your eyes. You get hit by the light, it hurts. Okay, that's just the way the body responds to it. Now, there are three divisions to the trigeminal nerve, and with migraine, it tends to be involved with this thing. So you'll end up with anything that causes you to squint will cause the headache to get worse. So if you find yourself squinting, that's generally the mechanism.
All right. I never squint when I go in the stages of light because the lighting's perfect and the signage is just right to direct me to what I need.
That's right. Well, come on in. We are located at 1917 Booth Circle. That's right off of I-4 and 434 in Longwood. Stages of Life phone number is 407-679-3337. Our website is stagesoflife.net. We're also on Facebook at Stages of Life Medical Institute. Like us, and you'll learn lots of interesting things there. Our office hours are Monday through Thursday, 8 to 5, and we invite you to come on in, wander about, and see what we have in our nutraceutical store.